So for this next part, we're going to combine both the patient client management system and the A for SOAP into one section because it's basically the same writing style, same components. You'll just see that they somewhat combine into a single approach where the patient client management um, approach gets absorbed into the assessment component for A. So we have a longer assessment component for SOAP note with that. And so we'll see the different components there. And you can see here, we've got 3 chapters associated with the assessment component in this SOAP note that will correspond to the 3 different sections associated with that. And the 3 different sections really are the evaluation, diagnosis, and prognosis. And we'll talk about what goes in each one of those separately. But the idea here is we're going to use the A portion of SOAP, the assessment, not just to give a singular diagnosis, but really to mention and link all of these impairments with the patient's reason for referral. So we need to go beyond just a singular diagnosis because we are therapy professionals opposed to diagnosticians. So our goal is not to come up with a diagnosis, but to come up with a therapy plan. So we need to link through the diagnosis and assessment the impairments with that reason for referral and the diagnosis. So we're going to be pairing these together with our own clinical reasoning and judgment to come up with that diagnosis and prognosis with that. So you can see how these differ slightly, right? The patient client management note has the 3 subsections. The SOAP note just combines them into a singular section. And in all reality, a singular section works just fine. So for the evaluation now, you're going to take this and you're going to identify the impairments, the activity and participation restrictions, personal factors, and environmental factors that are significant to the therapy, right? So opposed to doing an evaluation just to identify the diagnosis, right? We're doing an evaluation to identify all of these things as well. So we need to list them here in our assessment. When it comes to the second component being the diagnosis, there are therapy diagnoses and medical diagnoses. They can be slightly different or the same, right? The idea that a medical diagnosis is often much more associated with a physical condition, whereas a therapy diagnosis might have more to do with a impairment or functional or activity restriction associated with that. But you can see they are sometimes included in both ways with there. It's important that these are done in more informal language, and it's more than a single sentence associated with that. When we get into our actual diagnosis component, it's going to be more than just their diagnosis, as we see in some of these examples. Within that, right, we should include in that diagnosis being a therapy diagnosis as well. Some of the symptoms, the medical diagnosis, pathology, any prevention or compensation concerns. Within this area, we also might have a critical issues statement, right? Because this is initial examination, there is the possibility for us to need to refer them back out for additional testing, right? And we don't necessarily want to wait to diagnose or to document until we get that, because we should be documenting each time we see them. And so if there is something that we need to send out, we would do a critical issue statement in there that basically states that based on our examination, there is a possibility of something more substantial going on. We're not going to diagnose them with that being more substantial aspect because we would need more imaging, possibly, or just it's beyond our scope to actually make that diagnosis. And it's important not to be guessing with these sorts of things and telling patients what we believe opposed to what we know. So we would just document this in a critical issue statement stating that we need further assessment. The last part of this is the prognosis, and this is the believed outcome. And so this can sometimes be the first portion of the plan of care, or it is the last portion of the evaluation or assessment within there. It really doesn't matter, particularly it's more of a formatting in a preference thing because it is the bridge between the two. So we are, after we get through the diagnosis and all that, we are going to then document our professional opinion about the time it will take for the patient to achieve the expected goals and what our expected return to function might be. All right, so you can see in here some of this and how, depending on where it's located, will be what's included, right? Future treatment possibilities are much more likely to be included if it's the first part of a plan of care, right? Whereas the justification for further treatment is much more part of the assessment. So the worksheet for this one is going to be a little bit different than some of the others. That's just because we're combining so many chapters into this. So the first part, you're going to be identifying which of the different subcategories in the evaluation portion are there. So you have your list, the different subcategories. So in the first one, you're going to put whether or not this is an impairment, an activity or participation restriction, personal factor, or environmental factor. And then in the second blank, you're going to put them in a numbered order. So one is what you would include first, and so on. The second section or second part now is going to be more similar to what we've done previously. You've got a list here. You're going to identify, is this part of the evaluation? Is this part of the diagnosis? Or is this part of the prognosis? Then in the third aspect, you're going to be ordering these to make a logical sequence for a assessment component note. All right, so create your own appropriate subheadings and take this information and rewrite it into an appropriate order. The last part then is you're going to take the information from some of these different areas, right? So you have the history section for the patient we've been treating on page 83 and 84. You have the tests and measures on page 90. And you're now going to take this and within the subcategories they've already given you here, now write a note identifying from all of the different information that you've got. Now you're going to use your own clinical judgment, whereas in the past one, you're just ordering the statements. You are now creating the statements as well. Again, if you have any questions, please let me know.